All right, let's dive into the fascinating world of canine spinal surgery.
Sounds good.
In this deep dive, we're going to be looking at a research study that uses some really cool technology
Oh, yeah.
to compare different surgical techniques
Hmm.
for decompressing the spinal cord in dogs
Okay.
with thoracolumbar spinal diseases.
All right.
So the study focused on 4 different techniques.
All right.
One is individualized mini-hemilaminectomy-corpectomy.
That's a mouthful.
Yeah, it's a long one.
What's the abbreviation for that one?
iMHC.
Okay, iMHC.
Then there's mini-hemilaminectomy,
Much easier.
MHL,
Got it.
partial lateral corpectomy.
BLC.
Yes, and then the more traditional hemilaminectomy.
Wesley Shell. Right.
Exactly.
So all of these techniques are aiming to relieve pressure on the spinal cord.
Right, but they all go about it in different ways.
Yeah, you could say that.
Each technique involves removing different parts of the vertebrae. And this study looked at how well each technique maintains the spine's stability after surgery.
Oh, that's important. And how did they do that?
They used something called finite element analysis.
Finite element analysis.
Yeah, it sounds pretty high-tech.
Can you break that down a little? What is that?
Basically, it's like creating a virtual 3D model of the spine.
Interesting.
And then you can simulate these different surgeries on that model
Okay.
and apply forces to test it.
So instead of like experimenting on a real dog,
Right.
they're doing it virtually.
Exactly.
That's smart.
So they used CT data from a Beagle to build this model,
Okay.
and they focused on the L1, L2 functional spinal unit.
The L1, L2 functional spinal unit, remind me what that is.
That's the first and second lumbar vertebrae
Right.
and the disc between them.
Okay, so they have their digital spine.
Yep.
What do they do next?
So they simulated each of those 4 surgical techniques on this model
Okay.
and then applied forces to the model
Uh-huh.
in 6 different directions.
Oh, wow. 6 different directions. What were those?
Flexion, extension, bending to the right and left,
Right.
and then rotation to the right and left.
So they're really putting this virtual spine through the ringer.
They are.
And what were they measuring specifically?
They measured how much the spine moved in each direction
Okay.
for each of the techniques.
So they could compare them directly.
Exactly.
Interesting. And what did they find?
Well, the mini-hemilaminectomy, the MHL,
Okay.
showed the least amount of movement
Oh, wow.
in every direction.
So it's the most stable.
Yes.
Oh, interesting.
And then the traditional hemilaminectomy, or HL,
Okay.
showed the most significant movement,
Really?
particularly in extension, flexion, and rotation.
So the less invasive technique was more stable?
Yeah, I thought that was really interesting.
That is surprising.
But when you think about it,
Yeah.
the MHL preserves more of those structures that contribute to stability,
That makes sense.
like the articular process joint,
Okay, what about the other two?
the iMHC and the PLC.
Yeah, how'd they do?
They were both more unstable than HL when it came to bending side to side, but they were more stable in flexion, extension, and rotation.
So it really depends on the individual case.
Exactly. It's not a one-size-fits-all answer.
What other cool things did this study find? Well, they took it a step further and used something called contour plots.
Contour plots.
Yeah, those are visual representations
Right.
that show how stress is distributed within the vertebrae and discs
Oh.
after each surgery type.
So it's like a heat map.
Exactly, like a heat map of where the pressure points are.
So it helps visualize which areas are most vulnerable
Yeah,
after each procedure.
precisely. So like under flexion,
Okay.
all the models showed like heightened stress
Mhm.
at the articular process joint,
No.
the L2 vertebral root,
Uh-huh.
and the caudal side of the vertebral body.
But that differed based on the technique.
Yes, the intensity and distribution of that stress was different.
So each technique has its own unique pattern.
Right.
That seems really useful for vets.
Absolutely.
So they've been talking a lot about the technical details, but what does it all mean for dogs and their owners?
That's the million-dollar question.
Right, like what are the key takeaways?
So one big takeaway is that when a dog has ventrolateral spinal compression,
Meaning pressure on the side.
right, on the side of the spinal cord,
Yeah.
MHL seems to be the best option for minimizing instability.
Makes sense. That was the most stable in the virtual tests.
Exactly, but what about when the compression is ventral?
So like directly under the spinal cord.
Yeah, in those cases, iMHC might be a better choice than PLC.
Why is that? I thought they showed similar stability.
They did.
Okay.
But iMHC provides better visibility during surgery without giving up too much stability.
So it's a trade-off.
Yeah.
Better access versus a little less stability.
Right. Surgeons have to weigh the pros and cons.
For each case.
Exactly. Personalized medicine is key.
But no study is perfect.
You're right.
Were there any limitations to this one?
There were a few. One was that they only used a single dog model.
So, yeah, a beagle.
Right, a healthy beagle.
So it might not be the same for all breeds or dogs with different conditions.
That's a possibility.
What else?
Well, the forces they applied to the virtual spine were simplified.
Okay.
It was single-direction loads.
Uh-huh.
But in real life, dogs' spines experience much more complex forces.
Like running and jumping and playing.
Exactly.
So it might not fully reflect real-life stresses,
Right, and they also didn't account for the healing process.
which can vary between dogs.
Yes, and can impact long-term stability.
It sounds like there's still a lot more to explore,
Absolutely.
but this seems like a good step forward.
It is. It provides good information for vets and shows how important it is to choose the right surgical technique.
What are the next big questions researchers should tackle?
That's a great question. One area I think is ripe for exploration is the impact of these different surgical approaches on the surrounding soft tissues,
Okay.
like the muscles and the ligaments.
So this study focused on the bony structures.
Right. It didn't really look at how the soft tissues might be affected.
During and after surgery.
Exactly. So understanding how those tissues respond to different techniques will be really important for refining our surgical approaches.
And minimizing the risk of complications.
Yes, exactly.
Sounds like we have a lot to learn.
We do. Always more to learn.
But it's cool to see how science is advancing.
It is.
And how we care for our furry friends.
Couldn't agree more.
Before we wrap up, do you have any final thoughts?
I do. So as these surgical techniques evolve, and as we learn more about canine spinal biomechanics, I think it raises another question.
Okay.
What other factors will vets need to consider when they're choosing the best approach for their patients?
That's a good question, like individual anatomy.
Yeah, anatomy, activity level.
Maybe even their personality could play a role.
Exactly. I think the future of canine spinal surgery is really about taking a personalized approach.
So using the science.
Yeah.
But also understanding each patient's unique needs.
Exactly.
It's finding that perfect balance between that cutting-edge science and compassionate, personalized care.
Absolutely. And with continued research and collaboration, we can keep pushing those boundaries of what's possible and give our canine companions the best chance at a good life.
A long, healthy, pain-free life.
Exactly.
This has been a really cool deep dive.
It has.
Into the world of canine spinal surgery.
I agree.
Thanks for being here.
My pleasure, from Vet Neurojar.
Yes.
Keep those minds inspired, hearts light, and tails wagging.